What's up guys, Dr. Aaron McNally here with Revival Performance Physical Therapy, and today we're going to be showing you guys an exercise to stretch out your lower back, particularly on one side, and work what's called your Quadratus Lumborum on the other side. So we give this exercise to people that are a little bit weaker on one side, that are kind of like side bent a little bit. Probably not this bad, but something a little bit closer to this, where one side's a little bit more contracted and the other side's a little bit looser and needs to be kind of tightened up. So what you're gonna do on this one is you're gonna lay in what's called supine hook line. Basically just means on your back with your knees bent. And then what you're gonna do is hike those hips up. So basically standing, it would be like you're doing this. So you're using these muscles over here and tightening it up while you're maintaining a flat back. So I'll show you here on my back. So laying on your back with your knees bent, just like this. And then in this position, first, you wanna make sure your back's not arched like this, so you're kind of squishing your back flat, engaging your core a little bit, bringing that belly button down to the spine, and engaging that core a little bit so you're not arching your low back there. So keep your back flat there, and then from this position, not pushing with your legs at all, but just using some muscles in your core and a little bit in your lower back, hiking that hip up on one side. So you can kind of think of it like your tail or your sit bone on your one side is pushing down, and then on this side, you're hiking up. But not so much that you're arching the back like this. So keep that back flat and just kind of hike it on one side. And then I'll show you the other side. We may tell you to do more on one side than the other though. So there's the other side. Here's to the left, here's to the right, here's to the right. So it's not a whole lot of motion. A lot of people want to get more and try to use their back a little bit, but just kind of barely moving that pelvis. So your pelvis is here and you're just shifting it a little bit. So do the prescribed amount, have fun.